Okay, so welcome back, everyone. Glad to have you with us for this next segment of our conversation as we continue to get to know one another better and as we continue to talk about these problems that we're trying to solve, here at the Alliance. Thank you again for choosing this particular breakout session. Over the next hour or so, what we're looking to do here is to give you some practical tips that employers have actually employed, and some of the things that you've done that we know work because it's actually happened. So we want to drive the cost of healthcare down for these organizations, and we're going to try to give you the best information that we can to let you walk away with something that you could implement in your organizations when you get back to the workplace. So we're going to share those real-world stories, strategies, and best practices. And at the end, again, we're going to leave time for questions and answers. I was thrilled with the questions that we got at the last session. So please, you'll see that QR code pop again. If you want to use that, if that's easier for you to text, do that. Otherwise, grab that open mic either way. But at the end, we'll have time to ask questions of our panelists. So with that, I want to make sure I introduce you to the folks that I've got joining me to my left. First, Jim Beyer with the Fall River Group. Jim is the Chief Financial Officer of the Fall River Group since 2021. He brings a wealth of experience in finance, operations, and strategy. Prior to that, he led a $700 million global supply chain division at Fiskars Group. Jim has been a valued member of the Alliance Board since 2022. And thank you for your service.
Thanks, Kurt.
Next, we've got Pam Peterson. Pam is the Executive Vice President and Chief People Officer at UW Credit Union, as well as another valued member of the Alliance Board. Thank you for your service as well. We talked behind the curtain about those obligations. We're glad to have you as directors. As an HR leader, Pam is passionate about creating a great employee experience, driving engagement, and supporting development. She works with her team to align these strategies with business success, building a positive and productive workplace. In addition, Pam is also dedicated to mentoring women and serves as an executive sponsor for the Women's Leadership Network and Latinx employee resource groups at the UW Credit Union. So very accomplished individuals, very busy individuals, and they're taking time out of their schedules to be with us here today to tackle these important questions with regard to healthcare. So thank you for joining us and welcome. So as we start this conversation, I want to set the tone right from the start in this way. The things that we have done conventionally to manage our employee health benefits and plan designs aren't going to work going forward. I'm going to say it as plainly as that. So this idea that we can raise deductibles, that we can cost shift onto our employees, that we can somehow reduce benefits is proven not to be effective. And it's proven not to be a good employee engagement strategy, right? So we don't want to be heading down that path. We want to try something new and try something different and engaging. And so let's reimagine the way that we approach our healthcare cost solutions. So I'm going to start asking you a few questions. Feel free to answer as long as you care to answer, and then the other, please feel free to chime in.
Sounds great.
All right, so Pam, I'm going to start with you. So in your opinion, what's actually driving healthcare costs for self-funded employers? And was there a moment that you recognized what you needed to do differently, that you needed a new approach?
Yeah. During your opening remarks, Kurt, you touched on a few things that were very eye-opening for us. The first thing is our employees really had no idea what was impacting healthcare costs. And so the first thing we did is create greater awareness. We became very transparent with our employees as to what was driving the costs. We actually showed them what % the organization was paying versus the employee paying, so that they could actually see how competitive our plan was compared to other employers. We also shared with them that Wisconsin is the 5th most expensive state for healthcare. Also, the impact of Medicare to health care. And the hospitals or health providers are billed or pay out certain Medicare levels, and then the private insurance payers have to pay the remainder. And so that was really increasing the costs. We talked about the facility fee costs. And also the need for them to be very proactive and ask questions. So we did a lot of education to create awareness. We hadn't done that previously, so that was very eye-opening for employers. The other thing is that we really looked at our pharmacy costs. We were with PBM that we didn't feel like we were getting the discounts that we thought we should be getting. So we challenged that and quickly pivoted and found a new PBM. And it's been a night and day difference in the discounts that we're getting and the rebates that we're getting. We also contract with a specialty drug provider to get discounts for specialty drugs. So those are some of the things that we did.
Yeah, it's not enough just to become self-funded, right? That just, it gives you a seat in the driver's seat of the vehicle, but now
Right.
you've actually got to navigate from there.
Right.
And some of the things that you're talking about are real-time decisions that you had to make with regard to the PBM for sure, but also educating your employees, critically important. So Jim, anything to add to that conversation?
No, I think, you know, Pam hit the main points. You know, for me as the CFO, just looking at, you know, what can I do that's actually going to move the needle? Looking at health insurance as the third largest spend for the organization of, you know, you have your cost of goods with your materials, your labor, and then your, you know, third largest cost after that is health insurance. And, you know, it's a bit of an unwieldy topic. There's a lot to it, because there's probably 40 different costs that are going into that. And so what I would say is that you have to look at every piece. You know, there's probably 40 rocks you're going to have to, you know, look under. But under every one of them, there's an opportunity for savings. And I think if you look at them, you're probably going to be able to save 20 to 30% of that. So if that number is important to CFOs, I think it would be for most of them. It was to me. You know, that was an area I wanted to look at. And then secondly, thinking about it as our employees are our most valuable resource, they need health insurance and it needs to be a solution for them and their families. So just looking at it from those two approaches, it's something that while I don't want to spend all of my time on it, it's important for the employees, it's important for the organization, it's important for me.
Yeah, I think it's interesting that you are acknowledging that there's a lot of work that it takes to going into managing a self-insured program, but the benefits are there. So what I heard you say is, hey, I might have to turn over 40 rocks.
Right.
But there are benefits under those 40 rocks. What does that look like for you? As an organization your size, who's turning over those rocks?
So everyone's turning over those rocks. You're leaning on your partners. You know, when you're asking your partners, you know, how do I compare? How do I benchmark against my peers? What do I do well? What do I, you know, have opportunities on? You should be getting those answers. And I would say as you turn over the biggest rock first, you know, logically thinking about it, you're going to find that you're going to be, you know, networking and figuring out where to turn next. And, you know, I certainly didn't have the answers. No one in the organization will have all of the answers, but you just have to start somewhere. Some things you can influence, you can't control. Some things you can control. And so focus on what you can control, share, you know, and communicate what you can influence, and, you know, go from there.
Excellent. So, and I know that you are an active participant in some of the Alliance's work, producing some of our cost information to you and the TPAs that are related to that as well.
Yeah, for sure. So, you know, with that, I would say, you know, certainly, you know, TPA is an important partner. The Alliance is, you know, an important piece of that. You know, 65% of your plan cost is probably going to be medical claims, which the Alliance can help you steer those claims. Plan design, they'll, you know, be able to help you with your TPA and your broker to figure out how can you design your plan to capitalize on those, but also, you know, how do you capitalize on what was important last year, what's important today, and what's going to be important tomorrow, and making sure that what those decisions you make aren't short-sighted.
Pam, anything to add to that?
I don't think so.
Excellent. Yeah, these are great answers to our opening question. So I appreciate you being so thorough with your response. So Jim, next question for you. Where do most employers unknowingly spend overspend on healthcare?
Yeah, so I would say first and foremost, it's probably on the network side. So thinking about the things that you can steer, the benefits that you can you know, unfold by just basically having the preferred networks with the Alliance of using the same care at a preferred network. Just by joining that preferred network, you can knock off 10% of the cost for the exact same service. So I think that's probably the biggest opportunity. The other piece that was important for us, and every organization is going to have a different risk level and appetite for it. But I looked into stop loss insurance, and stop loss carriers generally make a 30% profit. And so if your organization can take on a higher retention and absorb that level of risk, in theory, they're going to have a 30% ROI on their investment each year. And then if you are putting that money away for a rainy day, accruing it, you're going to probably make, I'm hoping between 5 and 10% on that money that, in that third year when the more catastrophic loss does hit, that 30% is really turned into 40%. And so I think that's an area of opportunity. Now, that's not going to be for everyone. If, they don't have a strong balance sheet, it's probably not something they want to do, but I think organizations could be looking at it because stop loss carriers are making money. They have high overhead structure and they still make money. So if you can take on some of that risk, I think it's an opportunity for you and your employees.
Yeah, excellent answer. And I appreciate the fact that you've looked into these things and that you're actively thinking through that. I know that you had to make a decision most recently.
Yeah, so, for us, it was really looking and saying, what does it look like at, X limit, Y limit, and, getting those prices from stop loss carriers. Ultimately, we wanted to go without stop loss. And so the difference, I'll say, for the severity fund price of a $2 million stop loss versus, a lower or a larger number for that stop loss was not demonstrably different because they were basically, the stop loss providers were looking and saying, hey, we're protecting ourselves against the severity claim and we know one is going to happen. And so I think you just look at your organization and say, how do I not hit a retention normally, but have, save the farm insurance in case something does happen? And I think you'll find out that the difference between a, $2 million, stop loss limit versus a 300 might surprise you. There's not maybe that much of a difference depending on the size of your organization. So.
Very good. And this is a sophisticated organization. These are the topics you get into when you've been self-funded for a while and you're starting to find that next opportunity. So if you're out there wondering, well, gosh, do I need to be thinking about that as a newly self-funded group? Positively not, but know that those options and opportunities are out there and that our membership are having those conversations. So if you're interested in it, talk to Jim afterwards and he'd be happy to share his experience with you.
Mm-hmm.
Sure.
So Pam, when we talk about the preferred value providers and having those in the tier one, how specifically has UW Credit Union used your education of your employees to increase the volumes to those PVPs?
Mm-hmm. Yeah, in the last year, we've added a lot more preferred value providers to our tier one. But we also put some things into place, and Bobby Joe talked a little bit about this earlier, about incentivizing our employees to using those preferred value providers. We really amped up the navigation or assistance to our employees in navigating and finding those PVPs. And employees can reach out to this navigation tool and say, okay, here are the best, better, good, and high-cost providers. And if they go and utilize one of the best or the better, then they can get 10% of the savings that the organization has incurred by using those lower cost providers up to $5,000. So they're getting dollars right into their pocket for using the best and better. And so that's the way we're incentivizing our employees. And they're even able to do that for just preventative care where we're paying 100%. If they've used some of the better and best providers, they can even get some dollars in their pocket, even though the organization is paying 100%.
That's fantastic, right? Mm-hmm. But it does take that level of financial incentive to get employees to think, act, and do differently.
Yes, it does. Right?
So just an important element of this. And we're only as strong as our weakest link in this entire chain, right? Mm-hmm. So it's great to understand where the opportunities are. It's great to put in place benefit plans that support that. But then you really do need to get down and educate the employees and incent those employees to do the right thing.
Right. Right. And it's teaching them to be advocates. So it's not just the organization's responsibility. Yeah. It's the employee's responsibility. So, and even tying it to their overall compensation, do they want merit increases? As an organization, we'd rather provide merit increases and bonuses versus putting all of the costs to healthcare insurance. So when you lay that out for the employee, that encourages them to also be an advocate for themselves, and we're teaching them how to be an advocate. So it means talking to your providers. They might get pushback saying, oh, if you go to those tiered 1 providers, the quality may not be as good, or we can't accept those scans. The employee really needs to learn how to advocate, but also between the broker and the alliance, helping the employer to be able to navigate or bridge those conflicts when they do run into those conflicts.
That was a pretty thorough response. Jim, I don't know if there's a gap there for you to fill.
Not really. That was exceptional, and I would say I'd probably just be repeating most of what she said. So really great.
Excellent. So let's shift to the next question I have then for you, Jim. So many self-funded employers don't have the time or resource to overhaul their entire benefit strategy. So what would be the low-lift, high-impact changes that even a smaller employer could make to find the benefit?
Yeah, so I think, first and foremost, looking at that data of the Alliance Network, that 65% of your spend probably, and figuring out, what areas can we be steering, and maybe you don't even need to do a plan design change. Maybe it's as simple as just communicating, because most of the people at benefit plans, 5% of them are listening at that time because they actually need a service. The other 95% aren't listening, and so is it just communication that's making its way home to the consumers of the healthcare, whether it be on a piece of paper, a QR code through your HRIS system, that they access their pay stubs through. Just having that in various different places that they can be thinking about it, that when they are ready to consume, they're doing it in a smart way for themselves and their the employer. So I would say that's probably the first thing that can be done. And then the next one is looking at, how do you design your plan to incent the right behavior? Ultimately, unless people are incented, they're going to act in the most convenient way for them. And so you want to make those two things be aligned. What's convenient and what's economically viable, while giving them excellent care, because no one here wants to have bad care that's going to cause just kick the can down the road. So that's certainly not something that we would want, or anyone here, I believe.
Yeah. So what I've heard you both say, answers to different questions, but a similar message, is that you really have to spend quite a bit of time educating your employees about these changes, right? And I'm a sports guy, and I like analogies. So I'm envisioning this like an NFL playbook, right? So if we take the traditional approach of how we would educate our employees, we'd be like handing somebody the playbook at the start of the season and saying, read this, and I'll catch you on game day, right? And we'll see how that works,
Right.
right? As opposed to, how do we practice these skill sets, and how do we encourage practice of these skill sets so that they become ingrained in the employee base? And then, to what extent do you all have employees learning from one another? Are there opportunities for that to happen in your organizations? I know that some do, but I'm not sure how broad spread that is.
Go ahead.
Yeah, so for us, I would say that, an open door policy with the HR and their managers, that's important. When they have a concern, or when they want to learn about the topic, they have an open door to the right person. And so, I think that that's probably the most important piece is, you need to be communicating it at the time of the playbook, but also, for HR to have enough knowledge about the topic, because this is complicated. I know enough about it to be dangerous, but even for me, navigating the healthcare industry it's not easy. And so, that HR person is going to have the answers. And that's where I look and think about, if the organization has turned those 40 rocks over, those individuals are going to know a lot more and be able to help those people. So I don't know if that answered your question. But.
It's excellent in terms of what resources are available to your employees to educate themselves and to better take advantage of the benefits of the plan design.
Yeah.
Well done. Pam?
Alluding to the playbook concept,
Yeah.
is that just not during open enrollment, having a communication strategy throughout the entire year, and always be sharing information. and even utilizing your vendors to send them emails, or creating a one-stop shop where employees only have to go to one spot to get the information they need. They know where to access it and how to access it, and through different modalities. There's videos to watch, there's reading, there's a variety of ways that employees can access and input or get information based on their learning style or with their preference, and making all of that available to their family members too, because oftentimes it's the other spouse or the other partner that is making the decisions versus the employee. So making sure that that's all accessible to them.
So I have heard that topic come up several times recently, right? That I'm the person that holds the insurance, but I'm not the healthcare decision maker.
Right.
Right. And so it's really important to get that message home. And interestingly, I have heard a couple of different folks advocate for the old school, send a postcard home in the mail.
Yes.
Right? Because that ultimately gets read, that ultimately, gets internalized and actually is impactful. You're nodding your head.
I completely agree, and including that QR code
Yeah.
to that one-stop shop, so the family has access and they can just take a picture of it and have immediate access to that one-stop shop.
So the USPS is still alive and well.
I agree. I believe in that.
Excellent. Yeah. All right, let's move on to the next question. This is now to both of you. So can you give us a real world example? So a strategy that worked for your organization, talk about the results, as specific as you can. And was there any resistance when you initially, laid it out? Did you have any pushback, or did you actually have, a warm reception? Did it roll out smoothly?
I can go. So we increased our retention level for stop loss. I would say that the results were what we expected. They were good, so that's really no impact. So that was, like I said, no impact. We've done different tiers, and I would say that what we did was we looked and said, we didn't want to increase an employee's cost. We wanted them to have an option that didn't increase their cost. So we have a free option, we have a $250 deductible option, and then we have a $500 deductible option. So those are basically our tiers. And when the majority of the share was at the $250, so we basically said, hey, we're going to keep everyone where they're at $250 deductible. And along with that, you're just going to have to go to these specific networks, and you can keep that. You can go to the same doctor you've went to for years, and we don't want to take that away. It's just going to cost a little more. So that's how we did it. I would say that there was some pushback. People will complain about anything. And I've learned that even with a spectacular plan, people will find a reason to complain. But generally speaking, they understand the big picture, and if you communicate and with what the intention is, and for our organization, that's easy. Our intention is to take good care of our employees, and so as long as you're genuine with that, I think people will listen. That's not to say there's not going to be communication challenges, and the organization needs to be ready to stop what they're doing and make sure that that's the most important thing on that employee's mind that particular time. You have to stop, even if you're busy, and be able to solve that and help them through that. If you're not willing to, change is going to be a lot harder.
Yeah, so you really got to invest in this from the top down, right? So
Yeah.
you need C-suite support for this to make sure that the resources are available in the moment.
Yeah, and that's actually something that's probably important, and our brokers commented on it. For us, at an annual benefit meeting, or when we're talking about this, there's always an executive in the room to let them know how important it is. I'll be there, the CEO will be there. There will be someone that, everyone knows that this is an important topic. It's obviously important for their well-being, but it's important to the organization. And, they also know that we're consumers, and so a little bit of, just to share a story. So my wife is a provider at one of the health systems, and our doctor happened to be in a network that we were trying to steer away from, family friend. And so for us, it was, we like that provider very much, but if I'm asking employees to do something that makes sense for them and the health plan and for the company long term, I have to be able to walk the walk and talk the talk. So we made a change, and I would say that it took time to provide the right provider, but that's the employees know it's important to us, and So I think that sets that good example.
Yeah, by being willing to
Yeah.
go through the process yourself and implement the change and knowing that it impacted your family personally.
For sure.
Yeah, impressive. So Pam, same question.
Yeah, what I would add to that is listen to the employees as well, and listen to their experiences, hear their stories, and share those success stories, but also hear what's not working. Last year or a year ago, we surveyed employees, and we were really hearing the struggles that our lower paid employees were having. We had only a high deductible plan. And so we were able to add a copay and a high deductible plan, and that had really, we received a lot of appreciation from the lower, because they just wanted to be able to plan better financially or budget better,
Yeah.
and anticipate those expenses. In addition, we recently did another survey to find out what is most important to employees, and it was extremely insightful to find out the two top most important benefits they have is their vacation or time off and their 401k match, which was really insightful. And those two came before the out-of-pocket costs or the deductible costs. Certainly, we got some good information on that, but
Yeah.
it gave us, it helped us uncover some of those rocks that we needed to uncover and really focus in on where we're going to get the biggest gain from our employees' perspectives.
I'm going off script here for just a moment, but I think it's an important topic that a lot of our employer groups are interested in. So employee surveys, right, is kind of a topic that can be controversial, right? So how often do I survey employees? How many questions on the survey? And what kind of participation do you see? Are you seeing enough that it makes the difference?
In our recent survey, we had about 50% participation.
Really good.
Honestly, I was really nervous about the survey and what we would hear, with concern that we may not be able to take enough action to, once you ask an employee for feedback, you should do something with it and share
Right.
back with them. And so I was really nervous, but I'm really confident that that information is going to allow us to focus our communication strategy, also really zero in on what matters to the employees.
Very good.
So that then they're sharing the stories with they're our best promoter for future employees. So they can share their experiences that way.
Excellent.
Yeah, what I would say is just, whether it be a survey or forums that, people are able to speak candidly, things that are a problem for them will quickly rise to the surface. Things that you're doing well, oftentimes will just, remain silent. So sometimes you have to pry those things out. But it's really is nice, and I agree with the priorities of what employees are. So I think it's good to know those things so you can make prudent decisions.
Yeah. The feedback loops are critically important as you're going through moments of change and transition, right? So how well is it understood? How well is it hitting the mark or not? And do you have to make an adjustment, or can you continue to hit the gas? Yeah. All right, the next question I've got, looking to improve how easily it is to use some of these services. So many employers work with multiple vendors. What one question should every employer be asking their vendors to make sure they're getting a fair deal?
So how do I compare against my peers?
Right.
And what do I do well? And what do I do poorly? Those are my three questions.
Interesting, yeah. Pam?
Similar answer, and looking at the data and using your broker to help you discern all of that information, especially if you have multiple vendors, helping them bring all the information together so you can decide where you're going to focus your time and energy. And really focusing on the big things. There's lots of things you could do, but really focusing on what are the big things that will make a huge difference.
So I know that some groups, and this sounds maybe a little more sophisticated than it needs to be, or than maybe it is in practice, but there are groups that use a vendor scorecard. And so it's not just the price point that is important to them, but there are other attributes with regard to, alignment or ease of business to do business with, that kind of thing. Can you speak to any of that? Were you looking at just price points when you were making your vendor selection, or was it more than that?
We don't have a vendor scorecard that we use necessarily, but we also, there's an aspect of culture and the type of employee experience that we expect. And so we do evaluate that when we're looking at other vendors, is to what kind of experience or interaction will our employee have, whether it's FMLA experiences or that we want them to have the same level of experience that they have internally as well.
Yeah, so for us, I'm always concerned about just the initial price, because that reflects certainly not the whole picture. So, we're very conscientious about being, penny wise and dollar foolish. And so for us, I would say that it's probably more of a touch and feel, like, are they, does what they're saying make sense? We're certainly happy to pay more for the right service, because if it's driving the right behavior, the ROI is going to be significant. So it's certainly not going to be price point just out of the gate that's going to drive it for us.
So I want to emphasize what I heard, and I want to make sure that I'm not misstating what I heard. You all care about your employees. This isn't like we're going to try to reduce the cost, we're going to try to cut benefits right to the top of the conversation. But no, we really do care about these folks. We are taking that into consideration when we're making our vendor selections, and we want this to be a really good patient experience.
Mm-hmm.
Absolutely.
Yes.
And so critically, a critical component of the design
Yeah.
for you is that employee experience, and their feedback is important to you.
Right. And we utilize our broker and the alliance when employees don't have a great experience with the vendor, and really partner with you all to help us improve that.
Mm-hmm. Yeah, we can make adjustments, right? Change the people or change the people.
Yes.
Right.
Right. Wonderful. Okay, so looking to practical information that the folks in the audience can take away and implement right away. So if you were to say, gosh, if an employer wanted to start lowering costs tomorrow, what would be the first step to take? So where do they start? What phone call do they make? What email do they send? Where do they begin the journey?
I would say the first step is coming here, and with the lion's share being medical claims, talking with your representative for the alliance. They're not going to certainly have all the answers, but no one probably has all the answers. Otherwise, we wouldn't be having these forums. But certainly here, there are a number of people that can help you. So I would say that's coming to this meeting is the first step. Reaching out and doing having an action item. It's easy to sit here and pontificate about, this stuff is tough, and it is, but just, putting one step in front of the other. Everyone's walked before they ran, and it's no different with healthcare.
Excellent advice. I appreciate that. Pam?
I would say looking at your lower cost providers, or those tier one, and try to make it as broad as possible, in addition to educating the employee so that they know where they have some influences in managing, having more control over their experience and what they're paying out of their pocketbook. Those would be probably the two big things.
So a related question, but a little different, and I think this will be helpful for our employers to understand where your mindset was and now where it is. So when you first took the step to become self-funded, what were the motivating factors at that time, and has that changed now that you've been self-funded?
We wanted more control in managing the expense, and we didn't have access to information. And so that has been great to have access to information, know how we're comparing to others, understanding where we can have greater influence and control the increases that we were incurring with fully insured.
Yeah, and without knowing what was causing those increases,
Right.
or what you could do to try to curb them
Right.
in that fully insured space. How about you, Jim?
So it's difficult for me. I mean, we've been self-funded for decades, and so that decision was prior to me. But what I will say is, for me to get involved, what made it impactful is just in previous life, I was overseeing finance in various different countries, and so I knew what the costs were in single-payer countries for health insurance. I knew what it was. As a hybrid model, and I knew what it was in the U.S., and so it's, those disparities were significant. And then also, my family and I, we were expats in Europe, and so, we lived with a system that was different than here. And so, and then with my wife being a provider, like all of those things for me, there were stark differences, and I realized like there is an opportunity to improve this in a significant way. And so when I came to Fall River, it was already important for them, but I knew that, I didn't want to turn over 40 rocks, but I knew it was important because it could move the needle. So that's what it was for me, just to dig in further with self-funding.
Yeah, I mean, this is great advice for folks to take away, right, on the journey, and that you never ultimately get there, right? There's always something else that's there to be tweaked, something else to be looked at, something else to be improved upon, and so you've got to really dedicate yourself and your team to that understanding that this isn't a one and done, a set it and forget it. Can you speak to that a little bit? So what do you have for support infrastructure at your organizations that keep this top of mind for you and make sure that you've got the support for your employees that they need?
Well, as far as staffing, I have as part of our Total Rewards group, we have 5 people on our team. But I think the broker is huge. They work really hard for us, and having the right broker is a game changer for us. And they teach us stuff all the time. They're very proactive in bringing information forward to us, so that's really critical, in addition to the partnership with the Alliance and having direct contact with the Alliance as well. Provides just a wealth amount of information. And so I set the expectation of our team that they keep fluid on what's happening in the industry, how competitive we're remaining, or that we are, also networking with their peers in other areas so that they can bring that, and then the information we have from the Alliance, and then the information we have for a broker. So we have that stool of 3 inputs that helps inform us.
Yeah, multiple sources of information, right, that's advising you and keeping you abreast of what's happening.
Right.
Yeah, so for us, I would say that the majority of the information, a lot of it's looking at our own data. We track expenses carefully. But I would say that, it's not changing too many things at once, and it's looking at what did we do last year, and what changes did it drive? Do we need, if we're charting a course from, Europe to North America, we charted it as a straight line, and we may have, had that positive intent, but you might look and say, oh, there's a hurricane or there's an iceberg, and you might want to turn around it or, veer around it. And so I think looking at, what did you do? And so for us, it's every year we have a forum and we're looking and saying, what did we do? What were our objectives? What do we want to do differently? And then, what ideas did we get from these forums, from networking, and turning over those rocks that we want to implement and augment. And so, I would say for us, it's just those consistent forums and making sure that we're not missing them.
Stay dedicated.
Yeah.
All right, I think at this point now we're ready to open the discussion up to our audience to ask questions. So again, take advantage of the texting feature that we've got, or grab that open mic and step up, and we're excited to hear from you.
Our first question is for Pam. When providing the 10% savings up to $5,000 when using the PVPs, how are employees getting those reimbursements? I'm assuming that would have to be taxed as income somehow.
It is taxed. And we have a third-party provider that does all the administration, and they just send it directly to our accounting, and it's included in their paycheck.
Of the 65% of healthcare spend going towards medical, what do you do to control the spend of high-cost claimants that are usually making 80 to 90% of your overall medical spend?
So I think that stop loss is, a big part of that. So obviously those, high cost claimants are going to probably go up and hit your stop loss layer. If you want to save 30 to 40%, increase your retention. So I think that's one of the ways to do it. And then, thinking about what you can control for what you can influence, I would say the majority of costs are really driven by diet and lifestyle. And so it's all the small decisions, that you're making, whether it be, if you're having a picnic at your organization, whether you're having lunches in, what are you bringing in for food? Is it incenting the right, the right behaviors and leading by example? So I think it's all of those things. I don't have the answer to how to solve a high-cost claimant, because the reality is they're going to happen throughout, population. But I think it's all of the small things that you can do to mitigate it and turn $1 million claimant into, maybe reduce 1 out of 10 with diet and coaching. And maybe it's, reducing that $1 million claimant to 600,000. So I think it's all of those things that are important for us.
Yeah, I don't think there's one thing, but looking at each of the scenarios and identify what lever can you pull. Is it a high-cost claimant because of pharmacy? And so are there some specialty drugs that we can link to getting some manufacturer rebates? Or it could be even, it's a chronic condition that someone has, and maybe there's governmental programs that can help supplement or support their care. So it really depends on each scenario. Sometimes it's just a one-time occurrence, but if it's really focusing on the ones that are chronic and will be ongoing, is what can you get down to that individual scenario and what can you influence?
Yeah, and on that, on that one individual, are you at the center of excellence? Are they getting care at A when they should be getting care at B? It's not that B isn't, A and B aren't good at certain things, but if it's, I can't think of it. A liver transplant is, one provider better at liver transplants. Do they do 80% of the ones in the United States and they're really good and efficient at it? Maybe the answer is yes, maybe not, but ask a question.
Yeah, so get involved, get educated, get into the detail.
And related to what you were just talking about, are you doing anything from a wellness perspective to incentivize better lifestyle choices?
So we are, I would say sending out communications, getting people to think about it, taking the opportunity at New Year's when it's, top of people's mind to communicate the wellness programs that are out there, gym membership reimbursements, and all of those things that can move the needle. And you're not going to get 100%, but if you, each one reach one, and next thing you know, over time it compounds and you make a difference.
This is an area that we are really focusing on, and we have an opportunity to improve. We're 3 years into being self-insured, so we've just tackled certain things each year. But this next year will be about our well-being and condition management, and really zeroing in on that. So that's one of our big strategies in the next year.
Yeah, so again, I think a legitimate strategy to avoiding the high-cost claimant is to start early with these folks before they reach that condition, right?
Yeah.
And again, to your point, Jim, maybe you can't manage that high-cost claimant in the moment because they are where they are, but how many of those folks could be high-cost claimants at some point that you
Right.
intervene and manage so that they
Right.
avoid those expenses? Yeah, great advice.
Jim, since you have manufacturing staff and office staff, do you notice a difference in how the two groups interact with their benefits?
Not really. I think that, at the end of the day, we're all individual that have healthcare needs. It might be easier for someone that's office staff to be able to knock on the door next to them that's to someone that has the answer. But that's why for us, it's important that at these benefits meetings, we have an executive that if they know, whoever it is in the organization, whatever location, they've got my email, my cell phone, whatever it is, they can reach out to me and I'm going to take the time. The CEO will take the time. And so for us, that's how we combat that. But I can see there probably would be a differentiation in some organizations.
Do either of your companies cover GLP-1s for weight loss?
No.
We don't.
Yeah, so the statistic that I have heard on the GLP-1 adoption rate as part of a benefit plan design is about 30%. So most are not covering, and so you would fall into that category of the majority. Yeah.
Is there anything you've implemented that hasn't worked and you've had to roll it back?
So I can take that. For us, that I would say that the answer is no, but there's a number of things that we thought we were going to implement, and when we did due diligence on the topic, started asking more questions, going down the path of building material of how to roll it out, I would say that there were, curves in the road that were preventing us from going forward. So for us, we didn't ever roll anything out to employees that didn't work, but there were plenty of initiatives that we thought were going to be good options that we decided not to pursue once we put the material and put the diligence in place to evaluate it.
Yeah, the closest thing I can think of is what I shared earlier, is that we started with PBM, and we weren't getting the discounts, so we pivoted very quickly and made a change. So that would be the closest thing. So it's just more lessons learned and being flexible enough to pivot quickly.
Yeah, excellent. And you must have had feedback that you received early on enough that demonstrated to you that this just was not working and that you wanted to do something different.
Right, because we were told at the beginning of the year we would get certain discounts, and we weren't experiencing that.
Sure.
And so by the fall, we knew that we needed to do something differently.
Yeah, so again, doing the diligence to make sure that you're following up on and checking in on some of these solution sets that are being offered to you and that you implement.
Is there anything you were surprised your employees reacted to, either positively or negatively, regarding your benefit changes?
I would just say, like I said before, I mean, for us, we have a really rich benefits plan. And so anytime that you touch that, it's even if the intentions are good, every now and then you'll get a question or a comment that's a bit of a zinger. So I guess I'm surprised that happens. I shouldn't be, because it's been consistent throughout my career. But sometimes that's a surprise. But I think you just have to listen for what the person's intent was and try and make them understand what the reason is, versus just how they're seeing a consequence for them individually, and just try and bring them back.
I think one thing that was really interesting is, I think, just listening to the employees and understanding where their pain points are. We were getting a lot of feedback on our deductibles, that they were too high. But then when we went back, we hadn't changed our deductibles for 5 years, so why are you all of a sudden raising concerns about it? So just going back and re-communicating and educating the employees that, we haven't changed these in 5 years, so what is it that's causing the pain right now?
Yeah, interesting, right? So that you do have to do a little bit of investigative work here, right? So that you can accurately communicate with your employees. And as you suggest, when you're asking for feedback, you have this obligation of responding and making sure that you're providing adequate answers, right? Excellent. Other questions that we've got for the panelists? Yes, there's one here.
Can I just speak up?
If you could use the mic, I'd really appreciate it. If somebody could even come to you. Do we have a staff member that can?
Oh, I can stand up.
Okay, great.
So you've provided great insight into all of the, ways you communicate to enable really the skills and knowledge and behavior. I'm curious what metrics, given there's like 40, 100,000 different levers you can pull, what metrics do you look at to determine if you're meeting your healthcare strategy in these forums, the end of the year, quarterly, annually?
So I can go. So for us, we look at the total cost of the health plan, tracked at the different natural spend areas. And so we're looking at that per year, and then per member, and per employee. And if we're moving the right direction, and then also comparing that to what the benchmark was. So if healthcare cost is going up at 10%, obviously we'd love to go down. But if we only went up 3%, we were really happy with that result, because it beat the trend. So.
We do the exact same thing.
Yeah, so and there is more data available today than there was even in recent history, right? That you can use to benchmark yourself against the competition or others that are on similar plan types.
Yeah.
Very good. And I know that we offer some of those benefits as well with some of our reporting.
For sure.
Yeah.
Yeah, and I think what you talked about, the per member per month, I mean, I think that's ultimately the best measurement.
Yeah, it does not leave you anywhere to hide, right? It's
Right.
literally, what did I spend my total cost of
Right.
care over the number of employees that I've got? Yeah. Can you read that number? I can't read that number.
Oh,
Other
5.
questions?
There was mention of a communication strategy and an ask if it could be expanded upon, and also a question about communicating with spouses.
I can, we have a year-long communication strategy, and really this was the brainchild of our manager. She's very, very passionate about communicating and keeping it in front of the employees. And so, is it a certain focus, each month, capitalizing on what vendors have to communicate, whether it's emails or featuring different benefits, sharing stories. We have benefit briefings where they're videos. They're 5 to 7 minute videos. We've featured some things on those things. We also, this isn't necessarily related to healthcare specifically, but from right now the employees are really concerned about their 401ks and what's happening with that. And so we have a financial education team. It's part of my team that has been providing very proactive and partnering with our 401k vendor and educating and doing one-on-one sessions with our employees. So really, the purpose of bringing up that example is being really in tune to what's hot at the moment as well, and being able to provide that pretty quickly.
Yeah, those are great techniques of engaging your employees at different levels at different times. Right, and I know that one of the things that the Alliance did offer recently is the Power of 7 webinar. So if you haven't seen it, I'd encourage you to get out onto our website and review it. It's a marketing strategy that involves trying to educate your employees or reach them 7 different times throughout the year in 7 different ways. So give that a listen. If you haven't done that, that might be another way that you might get an idea or two about how you could improve employee engagement.
So the other thing I'll just add on that is, in our factories and bulletin boards, there'll be a QR code of recordings, and those recordings can be listened to in various different languages. They're also sent home with employees. So at any time, they can get a recording of that benefit meeting and scan and say, oh, I don't care about medical, I want to go to dental, and just scan ahead and listen. And we use AI to basically translate it to basically any language they want. So that's helpful for every member. They might not be there, listening to the English presentation, but they can, hear it in their native tongue.
That's a pretty impressive option. Is that a recent development that you've come
That
to?
is, yep, brought to us by our broker.
Yeah. Again, I got to believe that AI enables some of that to happen.
Yeah.
And I think those translation features and tools are pretty accurate today.
Yeah.
So another option if you have a multilingual workforce. Excellent.
I know we're running out of time. I'm going to ask one more question and just thank everyone who's adding ideas to the idea board. The last question is, do you have a spousal surcharge if they're offered coverage through their employer?
No.
Not for us either.
Very good. Well, I know that we're coming to the end of our time. I want to thank you both for your thoughtful answers and the complete and transparent answers that you provided. There's a lot of good content there for people to take away. Hopefully you all felt like there was information there that you could use right away and tidbits that you can go home and implement. So appreciate that. Also want to make sure that I mentioned to you that we've got a printed resource guide also available for all of our attendees today. It's called The Questions to Ask Your Health Plan Partner. And our account executives have got access to those, as well as there's a table, I believe, at the back of the room. We have copies available of that, so take advantage of that and pick that up for your convenience.